but that's who I am as a person, is I'm very family-centered. And I think that's what makes family medicine a perfect fit for me, is because it's also family-centered. So I love seeing mom, dad, kids, aunt, uncle. I see a lot of families because that's what I am passionate about, is my family. Hi, I'm Shelby Bohm. I am a family medicine nurse practitioner at OnPoint Family Medicine in the Denver Tech Center. I grew up right here in Littleton, Colorado, born and raised to amazing parents, and I have two wonderful sisters, and really, really love Colorado. I can't see myself living anywhere else. My mom is a nurse. My grandmother was also a nurse. I think I knew I wanted to go into medicine from a very early age. I love the type of upbringing I had, and watching my mom and my grandma before her, it was pretty clear. When I actually shadowed people in the hospital, it was the nurse that I wanted to be around. I found that the nurse was the one that was intimately involved with the patient. They knew what was going on. They knew not only the medical things that were happening with patients, but also what was happening with their family and emotionally. So a family nurse practitioner, or an advanced practice registered nurse, is an advanced degree. To become a nurse, you complete a 4-year Bachelor of Science in nursing degree. And then this is a graduate program. I think that that's what makes nurse practitioners so beneficial, is we have amazing medical background, but then we complete an advanced degree which prepares us to be providers. I met Nico when I was 18 at University of Nebraska. We actually went to nursing school together as well. He is also a nurse practitioner. He is a psychiatric nurse practitioner. We've gone through school together and have been married for 5 years, and now we're starting a family. My background in nursing is ICU. So ICU is reactive medicine. By the time a patient is with us in the ICU, we're reacting to whatever brought them in. We have no choice. It's worst case scenario all the time. So kind of being in that setting day in and day out makes you really passionate for preventing it down the line, which is really how I ended up where I am now. Being in the ICU really affected how I feel patients need to be heard. So my philosophy of care is really, I want you to know you're always going to be heard. I want you to know that we will do whatever it takes. ICU also prepares you to be an extremely big patient advocate. And that is something that I bring with me to family medicine, is advocating for you to always have the best care you possibly can, whatever that looks like. I think what BioT has done is provided another avenue for us to kind of address why people aren't feeling their best. You know, we go back to that high quality of life. How do we make patients have a high quality of life and feel their very best? And there's a lot of things that BioT does that really supplements that. OnPoint is amazing. I think it's one of those companies that really focuses on patient-centered care. That's kind of the root of everything that they do. When picking a healthcare company, I would never go anywhere else, just because I know what they stand for and what ultimately is their big philosophy. Really, it is patient-centered. It is focused on making sure that we're getting people the best care, whatever that means.